Hello, everyone. Happy New Year. And guess what? I am here with Tracey McDaniel.
Hi, everybody.
Tracey is a longtime friend and advocate of mental health. And first, I want to say thank you for everyone that has supported Behind the Smiles. And we are happy to start our new live here. I'm going to say, welcome to the patio. Welcome to the patio.
The patio.
Yes. So before we get started, we're going to be talking about mental health and how mental health has helped Tracey. And so, Tracey, tell me, before you started therapy, what were your thoughts about therapy?
So I think I shared a common view on therapy that many others shared, that it was kind of like most people treat a severe illness, right? Like a cold or a flu, right? Once it's severe, you go to the doctor. Once things are good, you just kind of... How I saw therapy before 2020. It was just one of those things that if there was something traumatic or really stressful going on in life, I'd go. Once I felt a little bit better, I'd discontinue it.
Okay. So it was like an on and off thing. Was that was prior to 2020? You were going on and off?
Yeah. I think the first time I went to therapy, I might have been maybe 19 or 20. It was at the conclusion of my first serious relationship. And I didn't feel very good about myself. So I went. The therapist gave me some coping skills. I applied them. I felt better. I stopped going.
So every time you went to therapy, you were like, okay, I'm done.
Yep.
I think that's what some people think is like, we go to therapy, we're good, we're fixed, and then it's like, okay, we're fixed and we don't need therapy anymore.
Yep. Something tends to be wrong. It caused me to go. Then I'll go, and once I feel better, I stop.
Okay. And I think most people or some people think of it that way. Or they don't look at therapy as we should go to therapy even when there's nothing wrong.
I agree. I don't think people see how it's kind of like a diet or like a transformation sort of issue with like something you're doing with your life, right? So, hey, I'm going to go to college. I'm going to continue my education. I'm going to continue with the skill set. I'm going to continue getting certs.
Yeah.
I don't think people see it that way, right? It's kind of like a one and done sort of thing. And it's actually most effective when you keep going.
I see it that way. I also go to therapy as well. And for me, therapy has really helped not just get through some of the situations as far as struggles, but also just like my day to day. I think some people don't see a therapist as almost like when people go for coaching, because they really kind of help you think of the things that are, moving forward in life as far as that. So after 2020, what was their decision of going back to therapy?
So 2020 was a hard year for me, but it was not just me. It wasn't exclusive to being a hard year for me. It was a hard year for everyone. There was COVID. There was everybody kind of sheltering in place and the shutdown. I lost my older brother, not to COVID, but I lost him in March of 2020. And then June of 2020, I actually lost my job. So it just felt like one thing after another. So I really went to really went to therapy to talk about being like now the only child and kind of grieving the loss of my brother. And while in therapy, I realized that there are a lot of other things I can talk about. And I just started to kind of peel back the layers of an onion. And I realized that there are all these things that happen in life that you brush off, or you just assume that it's just the rite of passage. That's just kind of life. But those are traumatic experiences that if you don't learn how to deal with them, they manifest and show up in life in really weird ways. Like, you could have a strange way of attaching in relationships, or you could have triggers that maybe we all have triggers, right? But something may trigger you that doesn't trigger others, and you don't understand why. And a lot of times it's from those past experiences. At least in my case, it was from past experiences. So in October 2020, I started going to therapy. and it is now January 2025, and I still go to therapy.
Wow. So 5 years.
I've not stopped.
Straight going.
I've not stopped. And I worked through the issues that I experienced in 2020. And I worked through some other ones in 2021. And I've been great. God bless. Knock on wood. I've been really good. But I realize that it's kind of like, it's like anything else, like maintenance with your car, right? Or maintenance with your home, or just maintenance with yourself. I consider therapy maintenance for myself. If I go once a month or every 6 months, not every 6, probably every 3 is the most that I've gone. I go and or we talk about what's going on in life or what my hopes and dreams and fears are. And it's cathartic. It's good to get that out, right? Versus, well, let's say something happens to me next week and it was traumatic, right? So I'm going to just kind of put that away and then wait for the next traumatic event to happen and put that away. And then when I go to therapy, I have these 10 things I need to talk about versus doing it in real time. I have stuff to talk about now. I get it out of the way and I'm able to move on with my life. It's also taught me quite a few coping skills and how to deal with stress and just kind of the trials and tribulations of life. And, there are a lot of things going on in the world and I have better coping skills because of therapy.
Now, you mentioned that you go and you talk about like future things that are going on. And these are things that are not necessarily happening right now, but they're like future things. How do you feel about the stigma that is behind therapy, also within the Black community? Because I know,
there we go.
So
growing up, Black family, therapy was like that taboo thing. You don't talk about it, right? It's not really something that's widely, or it wasn't widely accepted in the Black community. I think we've made some inroads and I believe that things are better than they once were. But growing up in my family, no one went to therapy. No one spoke about therapy. It wasn't something that we spoke about. When I was 18, almost 19, I came out and my mom was as accepting as she could be, right? It was something new for her. It was a different chapter in her son's life. But I remember one of the things that she told me, or she asked me rather when I came out is, do I need to talk to someone? I'm like, no, I don't need to talk to anybody. This is who I am. Actually, this is freeing. Finally saying this after all these years, I feel like I no longer need to talk to anyone. So again, it goes back to what we said earlier, that therapy was kind of like that visit to a doctor when you have the flu or when something's going on in life. That's why people would do it. It's not applied correctly, at least in my experience, it wasn't applied correctly, but I've learned and I've grown from it.
Yeah, I think what the stigma is, people feel like you have to be crazy or something. And that is the stigma that we all think about. Like anyone thinks about therapy, they're not necessarily always thinking about, oh, I'm just going because I need to talk to someone. And it's not that you have to, talk to that person. Like you said, it doesn't have to be every week. It doesn't have to be every month. It could be every 2 to 3 months, about, current things that have happened or things that are moving forward or, how to handle something within your job. And, those are some of the things that you could talk to your therapist about. At least I know I talk to my therapist about relationships and everything, just kind of.
Me too.
Yeah.
It's like I have a trained clinical friend who doesn't judge me for whatever I say and do, right? And it truly is. I think for your experience, at least it certainly is for mine, I consider my therapist my friend, right? My therapist, I asked if my therapist would come to my wedding because it meant a lot to me for her to be there because I was able to overcome obstacles because of her, right? And I wanted her to share in this moment. And she actually came. She only came for the ceremony. She was in and out, but it was great that she came. So in other words, like I formed this friendship with this person that's trained to kind of help me navigate through life and figure things out. Non-judgmental. I can say whatever I want, not worry about her repeating it to anybody. And like you said, it could be about everything. It could be about relationships. We talk about current events. We talked about the election. What do I want to do in the next 5 years? What do I want to do when I grow up? Like all sorts of stuff. No topic is really off limits. And that is freeing that you have this person that's clinically trained that no topic's off limits, right? Right.
And I mean, even though, you got your friends you can go to and everything. And I think with my therapist, she always asks, is there someone else that you can go to outside of when you're not seeing your therapist, which is good because you do. Mm-hmm. But with your therapist, they're basically non-judgmental. They see things a different way. They ask questions differently as well, I noticed. So mm-hmm. they kind of make you think outside the box of what's going on or looking forward to, what you're moving forward to. And one of the things I was going to ask you, how many therapists have you had? Because I know that having a therapist, you have to get the right one for you. And I think that's one of the other things is that people don't realize. And with the foundation, we always say, choose a therapist that you feel comfortable with, that you feel okay with. So how many therapists have you had to go through before you got to this person right here?
So I'll go back to how I used to use therapy. It was for traumatic big events in my life that I didn't understand, right? So it was my first relationship, I think my second relationship. Moving from Chicago to Florida was really difficult for me. Probably four different therapists. And the truth is I didn't really like any of them.
What made you choose, or how did you choose them? And then you realize, I don't really like them.
So it's not like you, and it should be better now. Like you and I openly discuss, mental health and how important it is to us to make sure that we maintain it.
Right.
I can talk to you about that, right? But a lot of times it's like, no one's going to tell you the name of their therapist because no one wants you to know that they go to therapy, right? So I went through the insurance website, typed in something I thought would work, and then I went, right?
Yeah.
And I was like, remember, I'm only here to solve whatever this problem is. I'm not here to be your friend or do something long term. I just need you to help me get over this hurdle. So yeah, that's what I did. I picked a name, I went. There was actually one time that I saw a therapist that I didn't like, and I didn't go back. Like, I really didn't like that one. But the other ones, I tolerated it. We were only going to visit, 5, 6, maybe 8 sessions, and then I was done with it, right? In 2020, it was a bit of a different approach. I looked to see what the insurance would cover. I found some names, and then I looked other places. And I chose a therapist that I thought aligned very well with my life. I met her, and she was nice, right? At first, I'm like, we're kind of feeling each other out. But probably after like the 5th or 6th visit, I was like, yeah, I think I can do this. And by being comfortable, it's like I opened the floodgates. I talked about my entire life, from childhood to adolescence to teenage years to adulthood to current events to past events. I thought it was important to just kind of put it all out there. Mm-hmm. And again, as I said before, it was cathartic to put it out there. It was healing, right? One of the hardest things that I dealt with, there was an exercise my therapist told me to do. And the exercise was to look in the mirror and apologize to the younger version of you and tell them it's going to be okay. Oh my God. That was hard to do.
That was very hard to do.
Right? Yeah. But it was necessary. I had to apologize and forgive the little me that didn't know any better to really kind of realize how far I've come and how great I am. And I don't mean that in a conceited way, right? But we're all great. You're all great.
Absolutely.
Right? Sometimes we struggle, sometimes we fall down, but it doesn't take away from your greatness.
Yeah, that's true. What has therapy done for you as far as like through the years?
You've been my friend for a very long time. You can answer that question.
It has done a lot. I can say that.
I got married, right? And I can't say that therapy was directly responsible for that, mm-hmm. But again, when you're walking around with, trauma, right? And losing your job can be trauma, right? Your best friend moving away is trauma. Losing a relative or something. Those are all traumatic experiences that most of us just put back in our head and we don't talk about. That begins to weigh on you. And you don't show up as the best version of yourself when those things are weighing heavily on you. So going to therapy, speaking about all the things that I was embarrassed of or the experiences that I had, allowed me to open up, be more open, be more accepting, be okay with who I am, right? I think people tell untruths. They tell stories out of embarrassment, right? We're embarrassed that, I tried out for the swim team and I didn't make it, right? So I'll tell somebody like, yeah, there were too many people, or their preference for the JV of the seniors. The truth is I didn't make it, right? But you're not comfortable saying that because it's an embarrassing moment. What therapy helped me to be is really live in my truth, right? There is nothing that I should be ashamed of. I'm no better than you or anybody else. We all have struggles. Things happen in life. It's okay, right? So therapy helped me to be more open, to be more transparent, to be more loving, to be patient. It's really helped a lot of things. And you'll say this as my friend. It's not that I didn't have those qualities,
right,
but they're far more enhanced and more natural,
yes,
right?
They are. They definitely are. I would say from 2020 to now, they are definitely more. I can definitely see where you're more patient.
Yeah.
I could definitely say that. Like, I know that, and even just your demeanor and everything has changed within the last couple of years and going to therapy. So I can definitely see that for myself.
It's helped a lot.
What are some of the takeaways as far as going to therapy? Like, what are some of the things that she actually that you're taking away and that you are utilizing now in I want to say real world. We're in real world,
right,
but I mean, daily life.
So my therapist early on had me read something called the four agreements, I believe it was. And one of the things in the four agreements is, be impeccable with your words. Things aren't necessarily about you. And just kind of look at the world and the interactions that you have with people differently. It's also taught me great coping skills, journaling, meditating rather, being mindful and being present. Oftentimes, because of the world and just how we are, we tend to fast forward, right? So we get out of work and we're thinking about what we have to do tomorrow, right? Yeah. And in the moment, we're sitting at dinner, or we're on the couch relaxing, and we're not even enjoying that because we're thinking about, damn, I have to wake up at 7 a.m. because I have to be in the office by 8.
Right.
I have to learn to live in the moment, right? Something else I used to do, and I still do it, but I've gotten better at it, is I always assume the worst, right? Whatever scenario it is, it's always going to be the worst. It's always going to be the outcome. And what therapy has taught me is that probably what you think is going to be the worst outcome never really comes to fruition. And she's right, it doesn't, right? Yeah. What I think is the worst case scenario has never materialized in 5 years.
Do you think you do that because you're trying to put up a wall so that you're not hurt from past trauma or past things? That's why you tend to think the worst of situations?
For sure. I think that's certainly a part of it. It's survival, right? So if I already think that things are going to be bad, I won't be hurt or disappointed, right? If anything, I can only go up. I've gotten much better at that, and again, because it's therapy, you need to be mindful, live in the moment, right? Meditate. I am worthy. Give myself grace. These are all things that I've learned and I've implemented in my current life, and I'm the version that I am today because of those things.
So I realized within these last couple of years, or just from, I would say, this new age, the 2000s, where we talk more about therapy a little bit more, maybe not as enough as we need to, because I think there's still a lot that needs to be done when it comes to mental health. But some of the things or the terminology that we use in therapy is like boundaries. And that is a new terminology for me, and also trauma. And what is your take on that? Because I know a lot of times within therapy, your therapist will tell you need to set boundaries for certain things, either people, places, things, or whatever. You need to set those boundaries. And I'm like, I don't even know what that is, right? I've never had to do that in my life. Like, set a boundary for what?
I didn't, I'll be honest with you, I didn't understand it, right? I'm like, what do you mean a boundary? Like I'm gonna draw a circle around me and you can't come in? And then she started to kind of probe, like, what are your non-negotiables, right? What is that red line that you don't want people to cross?
Right.
How do you want people to interact with you? How should people address you, right? These are all boundaries. And I had to think about it. I'm like, okay, well, yeah, I really don't like being invited to a party last minute for the last 10 parties. Like I don't, if we're great friends, like don't want to be the afterthought, right?
Right.
These were my boundaries, and this is my expectation of myself and the people that are in my life.
Right.
That was something I'd heard of it,
yeah,
but I really didn't understand how important it was. And I'm glad you brought that up because it is significant. You need to have boundaries, right? There are things that people do that are out of bounds that you've never said that you have to start. You have to start setting boundaries,
yeah,
right? People will treat you the way in which you allow them. And sometimes that's not nice.
Right. And I think some people don't know that they're doing it sometimes, but you know how you want to feel and how you would treat someone else. So, you want to make sure that you're getting that same thing back from them. So I get it as far as like boundaries, but I know it was like the new thing as far as most people are talking about. And I've heard people say it so much. I'm setting my boundary, and I'm like, I need to work on setting certain boundaries in my life.
It's hard because you think that by setting certain boundaries, people that are near and dear to you may take it any way other than it's to protect yourself and be the best version of yourself. We're always afraid to offend someone, right? Or I know this is true. It's true of all of us. There's this one person in your life, for whatever reason, you're afraid to tell them no, or you're afraid to, because you think they're going to leave, right? Mm-hmm. And honestly, the truth is, if you set a boundary and you tell someone that this is a non-negotiable and they do leave, let them go.
Yeah,
right?
They weren't supposed to be there.
Yeah.
That actually makes a lot of sense. And also trauma. That was some of the things we never talked about growing up. Or
what was trauma when we were growing up, right? I thought trauma was I cut my arm open and needed stitches.
Or there was something that happened, you got to go to the hospital.
Exactly.
I've never took trauma as the certain things that happen in my life that may affect the way I feel about certain things. That was not something I looked at.
Me either. I'm not going to say it's a new word that I learned, but I think the definition of it is vastly different than it was, circa 2020. One thing I will say, it's like during 2020 and COVID, there was people really sort of started taking care of their mental health and doing things to help themselves feel better. I'm a little disappointed. I feel like it's kind of weaned off a little bit.
Oh, yeah.
And it shouldn't, right? It's just as important as going to the dentist or going to the doctor, or if you have, some sort of medical ailment or illness that you see your regular doctor. It's the same thing. It shouldn't be any different, right? The stigma of mental health and therapy and asking for help, it really has no place in the world that we live in. Right. Because the world that we live in is it's full of distractions, right?
Oh, yes.
There are things that are behind every door. There's social media, which,
that's a whole nother
right, that can be a whole nother live, right?
That's a whole nother live.
There's so many things that influence your feelings and the moments that you have that sometimes you can't sort it out. You don't know it's like sensory overload. It's too much information and you don't know what to do with it. Therapy's one of those things. Journaling, look, for maybe those that don't or aren't quite ready to embrace therapy, journaling is also super effective. And if you're like me and you don't like to write and I don't like to type, I record. Like I'll just do voice notes of what I'm feeling or what I'm thinking. And then I'll walk away and I'll come back in a couple of days and I'll listen to that and I'll figure out like, where am I today, right? Yeah. Do I still feel the same way? Was it just a moment in time? Is this something that is going to continue? Maybe I do need to speak to my therapist about this. Or maybe it's just, somebody cut me off in traffic and I didn't like the way they gave me the middle finger. Like, it can be a bunch of reasons why, but you have to deal with it, get past it.
I think some of the things I didn't look at as trauma, or I mean, I guess I just felt like these are things that has happened to me, like going through a divorce and, you know, you raise your kids and, you know, different little things, changing jobs or moving. And there's a lot of different things in there that kind of, in detail that I probably went through, and I just things that you go through. I didn't really think of it as trauma, especially like divorce. That was like a really big thing for me, because I just, you know, you get married and you're thinking, oh, this is it.
Gonna be forever,
this
right?
is forever, you know? And then
it's not,
and
right?
then it's not.
And you're supposed to say to yourself, oh, well, it's not. Let me move on.
Oh my God. That was
but
like,
it's not that easy.
It wasn't. And so some of the things I did at that time, although I didn't have a therapist, I started writing. And to me, I thought it was just poetry, you know, but it was kind of poetry, but kind of journaling at the same time. But I was getting out every feeling that I had, like everything, because I was so hurt by, you know, certain things. And I'm going to say part of that helped me. It took me some time, and, you know, the forgiveness was more of forgiving for myself, like to let go.
Mm-hmm.
But even talking about it in therapy now, even though that happened like 2003, talking about it now also helps as well, getting out some of those old feelings and everything. So yeah, definitely.
You reminded me of something when I was 19 and I went to therapy when my first relationship ended. I went because I thought that I failed, right? Like, it literally was my first relationship, and I was madly in love, or so I thought, right? And 19-year-old feelings seemed very intense at that time, and it didn't work. So I went to therapy because I wanted to know how I failed. What my therapist at that time taught me is that I didn't fail, it just didn't work out.
Right.
Right? And I'm like, wow, I've never heard of that. Like, what does that mean?
Mm-hmm.
And she's like, it's just that. Like, some things aren't meant for you. It doesn't mean that you failed. It means that it just didn't work out.
Right.
I use that now in life. It doesn't mean I failed. It means it just didn't work out, right?
Right.
Means there's another opportunity for me, or that wasn't right for me. But again, therapy taught me that versus people that aren't successful with a certain thing and they beat themselves up about it for, you know, the next 10, 15
right.
years, or however long they're storing that trauma, because
right.
that's what it is. It's actually trauma.
Yeah.
Right? They're storing that trauma, and it comes out in weird ways.
Yeah.
Right? Like, I don't like to be rejected, so I'm going to ask if you want to do something, or I'm not going to ask you anything because you may say no, right? That's trauma, and that can have to do with rejection, with failure, and stuff like that. And
a trigger.
Exactly.
And that was something too that we never talked about, was triggers. Like, the terminology now is a little different. So, you know, talking about triggers and what can trigger you as far as like take you back to that time frame. I think therapy also helps you know how to deal with those triggers as well. Things that are going to emotionally trigger you, I think going to therapy helps you figure out, when I'm in a situation like this, how do I handle it?
Right. And it doesn't necessarily solve those triggers. It can help you cope with them and lessen them. And maybe in time, what used to trigger you may no longer. There may be a song that, you know, you and this person you were with, it was your song, right?
Yes.
And you hear it on the radio and you're like, oh,
I know that.
I can't listen to that, right? That's a trigger.
Yes.
But why can't you listen to it? Because you thought the relationship failed.
Yeah.
Or you could have done better. Or
think about everything.
Yeah, maybe you were unfaithful. Like, it could have been your fault. It could have been their fault.
Yeah.
But the reason why that song triggers you the way that it does is because you probably haven't dealt with that. Mm-hmm. Deal with it, right? And you hear that song, you're like, ooh, that's my jam. Like, oh, that's a bop. I like this. Like, you turn it up.
Yeah.
Because it no longer has that power over you.
Right. That makes sense, though. That makes a lot of sense. So is there anything out there you would tell anyone, even like the younger adults, as far as, and I'm going to touch a little bit on as far as like coming out and everything, what would you tell young adults, and if they felt like they needed to talk in therapy as well?
It takes a very courageous person to ask for help, and there's no shame in needing help. We all need help in life. I don't know about you, but I believe a doctor helped deliver me, right? I needed help then, right? And when we get older, we'll need help from people. Hopefully we're mobile and we're able to do things, but there's nothing wrong with asking for help. just because something isn't for someone else doesn't mean that it's not for you. I'm not Christy. I don't know what's impacting Christy, but I know how Tracey feels. And if Tracey feels that I need to get this out, I need to work on myself, I need to do it. So I encourage everyone to go to therapy, right? Talk to a friend if you can. Don't isolate yourself. Get the help that you need, or maybe you don't want to call it help. Maybe that's too controversial, right? But speak to people so you can feel better about yourself and realize that your journey, your path is different than everybody else's. You can't go around comparing and be like, oh, so-and-so's so strong. That's them. You're you. You have to take care of you. Everybody else in the world, every other personality's taken, you got yours. So, you need to work with yourself and be the best version of yourself that's possible. Life is hard. Life is stressful. There are a lot of things that take place that we don't understand. Keeping that to yourself isn't going to help you understand it any better. Sometimes you need to just say, hey, you know what? Let's talk. There's some things going on. I want to talk about them. Help me figure them out.
Yeah. Well, is there anything else you would like to share with us, Tracey, before we end our live? I want to thank you so much for coming and talking to me. I want to say Happy New Year to everybody. This is our first live, we're going to say from the patio.
On the patio.
On the patio, the first live from the patio. But I wanted to come on and talk about mental health and for the new year for 2025, because mental health is very important to us. And we're both advocates for mental health. So if you are between the ages of 18 to 30 and you are seeking or needing to speak to someone and need a therapist, we do have 2 sponsorships open and available. You can always apply at BehindTheSmilesFoundation.org, and you apply, and we have 2 sponsorships open and available. So you ever need someone to talk to? Also, before we go, we are both crisis text line counselors. So if you don't want to speak to someone right away, or you're looking for something or need to talk to someone, there is the crisis text line as well. Anything you want to add?
No, I was going to mention that at the end, that maybe you're not ready to meet with a therapist face to face or on Zoom. We're available. The crisis text line is available 24 hours a day, 365.
Yes.
And you don't have to tell your name.
It's all anonymous.
It's all anonymous, right?
Yeah.
We want to help you feel better and give you resources and guidance if we can do that. And it's non-judgmental.
Right. We're here to support.
Yep.
Here to support.
Yep.
Thank you for tuning in. I will look forward to talking to you all again, and have a happy 2025.
Happy 2025, everybody. Thanks for having me.